Hello everyone, I am Tuja Kurt. Welcome to our channel.
Hello everyone, I am Dr. Kazandi. Welcome to our channel.
The topic of today's video is wisdom teeth. I'm sure it has happened to all of us. They can hurt, swell, and lead to serious problems at the most unexpected times. Today, Dr. Kazandi will answer all our questions. First, I want to ask this. When should they emerge? Is there a specific age range for your wisdom teeth?
Wisdom teeth generally emerge during a period from 18 to 35 years old. They are commonly referred to as wisdom teeth because they typically emerge around the age of 20.
Well, in some patients, they can emerge at older ages. Is there a reason for this?
There is no specific reason for this. It is believed to possibly be genetically inherited.
Well, some wisdom teeth can be completely impacted or partially erupted. What causes this?
The most obvious reason for this is that the jaw structure is not compatible with the size of the teeth.
A small jaw structure is like having larger teeth.
Exactly. So, when the jaw structure size is not compatible with the width of the tooth, the wisdom teeth become excess teeth. Therefore, because it cannot find space, it either pushes against the other teeth, causing them to become crooked, or it remains impacted and cannot erupt.
So, do the partially erupted wisdom teeth need to be removed? What do you do, or do we wait for them to fully erupt?
Depending on the situation, if we check with X-rays, we monitor whether there is pain, discomfort, or any ongoing problems for our patient. If we see that it is not erupting, causing pain, creating problems, leading to misalignment of other teeth, or causing decay in neighboring teeth, we extract the tooth and remove it, which also relieves the jaw.
Yes, while you were saying this, of course, the question that comes to my mind is, what are the complications caused by wisdom teeth? Yes, we mentioned decay and misalignment, but can it lead to more serious problems? For example, related to the eye, teeth, or heart?
If wisdom teeth cause an infection, they can lead to serious complications. It can cause swelling in the face, swelling in the lymph nodes, and difficulties in swallowing in the neck area. It can cause pain that radiates to the ear from the upper jaw. Additionally, when it gets infected, it creates unhealthy environments because it lowers the body's resistance.
How will our patient understand? Because there are things we do wrong with eating with teeth. For example, we have thoughts like we need to remove a tooth as soon as it comes out. But aren't all of these dependent on certain situations? In which situations should the patient consult you?
The most obvious mistake made is postponing the procedure due to the fear of extracting wisdom teeth.
I had mine removed. There is nothing to be afraid of, by the way.
In other words, neglecting doctor checkups and thinking, I'll keep my wisdom teeth as long as I can. And if I go, it will be a very painful extraction. This kind of fear leads to the biggest mistake of postponing it.
Well, now there are situations where wisdom teeth require surgery. For example, mine was such a case because it was impacted inside. Can I explain it right away inside? Don't be a jerk to your words, but the honorable man won. My teeth were impacted, and that's why they were constantly causing pressure. I don't know what was happening anymore. It caused misalignment of the teeth. And as soon as I noticed that one of my teeth was moving back, of course I came to you right away and we took it out. Does it need to be extracted in cases of impaction? Sorry, does it need to be surgically removed?
So, it doesn't necessarily have to be just an impacted situation. In some cases, if the width of the tooth is too narrow to allow for extraction, surgery may still be required. But generally, surgery is required in cases of either partially impacted or fully impacted teeth.
As far as I understand, there is no need to extract any tooth that has come out without any problems.
If there is no issue in the X-ray findings, if it doesn't cause misalignment in the teeth, if it doesn't lead to decay in the adjacent teeth, and if it doesn't cause any infection, and if it is properly maintained, then of course, why should it be extracted?
It can stay where it is, right? Well, I want to return to the topic of surgery again. Is there anything patients need to pay attention to after the surgery? Because after all, surgery is an important matter.
They should not neglect the cold compress that needs to be applied, because the cold compress is the most commonly neglected aspect.
Are we going to do it like this outside?
Yes. When this is neglected, excessive swelling is observed. Also, neglecting the medications prescribed by the doctor.
Is antibiotic treatment applied after the surgery for any complications?
Antibiotic treatment is not applied in every case. However, it is commonly supported with a painkiller and an antibiotic treatment.
It is supported. So, is there anything you would like to add to our topic? Let me finish with another question.
I asked all of them very nicely.
We have studied our lesson in this case. Well, actually it is an unnecessary dental science. That's what I get from this kind of result. So, it seems that our chewing, or anything that our other teeth do, is not happening. And I don't understand why there are wisdom teeth, really. And I think many people have this question in their minds. Why wisdom teeth?
In terms of function, if there is a tooth deficiency, for example, if you had lost one of your molars early, the wisdom tooth would serve as your backup tooth. But since you didn't lose one of your teeth, it only caused crowding in your jaw.
So, a backup, actually. Yes. Okay, super. I didn't know that at all. It was wonderful. Thank you. I wish you health for your mouth. Don't forget to subscribe to our channel. You can direct all your questions to our social media addresses below and to Dr. Kazan. Goodbye.
Hope to see you again.